Welcome back to the Bahamas tonight. Across the world, the HMPV virus drawing attention as fears as a severe flu surface. But as our Lloyd Allen shares, a number of factors are at play that every household should know. Lloyd?
Now, by definition, the human metapneumovirus, better known as HMPV flu strain, is relatively new, first identified in 2001. Experts now peg the upper respiratory infection as a global concern. The World Health Organization warns, like COVID-19, this virus comes with a cocktail of symptoms, including congestion, persistent coughing, runny nose, and possibly hospitalization. However, the group most at risk, the very young and the old. Termed high risk, children 5 and under, the elderly, those with varying levels of immunosuppression, or patients living with chronic obstructive pulmonary disease, or COPD. Medical officials are now watching the annual quademic, now on the rise in the East. For example, HMPV cases in China, while considered normal for this time of year, have led to new cases in a number of countries, including India. But where does the Bahamas lie in this?
The HMPV is just one of the respiratory illnesses that exist, cause some challenges.
Acting Director at the Department of Public Health, Dr. Swann, assures poor health habits are among contributing factors, as well as exposure to an infected person's environment.
Persons with compromised immune systems, those who are taking steroids long term, for example, those who have asthma, those who are cancer, HIV, uncontrolled diabetes. These are individuals who are at more risk than others. Of course, those who are obese, because again, the ability to respond appropriately to chest infections or lung infections are slightly compromised.
Dr. Swann shares on the numbers.
HMPV is not something that we have received any positive tests for in recent times. It's something that exists, and we have tested in the past, but we have not received any reports of any positive cases. Influenza virus is something also that's circulating. It's having again, there's different forms of it. We can have it in parts of the U.S., and that's why we're keeping a close eye on it. But again, persons are staying home or being impacted with signs and symptoms of it.
For patients, educators, and others, the advice is to take every precaution.
Respiratory etiquette is what we continue to advance. If you have a cough and a cold, if you're sneezing and you're coughing just the crook of your elbow, or use a tissue and discard that tissue. Handkerchiefs are no longer something that you should be using except for decorations and style. If you have a runny nose and a cough again, wear a mask.
Now, Makushla, Dr. Swann says, while there has been talk of a more severe flu, the key now and always is to lock in prevention protocols to protect yourself and others. Makushla?
Well, Lloyd, some pretty good advice there for a lot of people who probably are suffering flu-like symptoms at this time of the year.
Hi there, I'm Corval Pyfrom. Thank you for watching our YouTube page. Be sure to like, comment, and subscribe for all things ZNS.